The first time someone makes a call to the Bonati Spine Institute, there's a good chance they may speak to Jenna Barlog.
I am married and I have 2 little boys, 7 and 15 months. Noah and Levi. We're a very active family. We love being outdoors. We love going to the gym as a family. I've been working here at the Bonati Institute since 2007. I'm currently a patient advocate where I help guide the patients from the beginning till their end of their process here. I did start in the neurology department and also I've worked in the clinic, so I've been hands-on in many different departments here.
Jenna spent her days helping people find relief from chronic pain, but what she didn't share was that she too was suffering.
My pain first started actually when I was a teenager. I've had low back issues just early on in life, and unfortunately the pain just escalated throughout the years. I did seek a lot of different treatment over the years, but in the last couple of years my pain just completely affected my life. The pain previous to surgery was constant, mainly on the right side of my low back, and it did radiate up into the mid-back, especially while I was seated. When I would be standing mostly, I would feel a lot of weakness in my right leg. I had hip pain on my right side, right glute pain. It was just sharp, constant, burning. Pretty much every symptom that you could think of I had on the right side. My pain affected my activities greatly. I am pretty stubborn, so I never completely stopped doing the things I loved. I would just unfortunately pay for it either that evening or the next day. But I would eliminate the gym quite a few days during the week, whereas normally I would go more often. But I did stop some of my gym activity. I did stop my running completely because I just couldn't do it anymore. My pain definitely stopped me from a lot of activities with my kids. I would find, especially with my 7-year-old, when he wanted to play on the floor, I would be playing, and then within a couple of minutes, the burning was so severe. I just felt so uncomfortable. I would constantly have to tell him that I needed a break and I needed to sit on the couch for a few minutes. And then, of course, I would go back to doing it just because I don't want to miss out being a mom, but it did affect every day.
After trying to avoid any type of surgical treatment herself, the pain she was experiencing demanded her attention.
I've tried a lot of conservative treatment over the years. Actually, before I worked here, I was a massage therapist, so I was very big into doing massage therapy. So I had a lot of massages on my back. I've tried acupuncture, I've tried physical therapy, I had an injection here at work at the Bonati Institute. I've tried a number of things, TENS units, not big on medications, so I tried to avoid that. I did a lot of home stretches as well, gym activity, anything that I could do to try to avoid surgery. The remedies that I tried didn't really help me long term. It was very brief. It would just maybe get me through a couple of days and then I was right back to square one. The point that made me realize that I needed surgery was after having my second child, my symptoms really became apparent. Every day I had pain. I had a new MRI and it was very obvious that my problems were worse and that I needed to do something as soon as possible. But I am a planner and I really wanted to wait until my kids were bigger. I didn't want to have to not lift my son because obviously having a baby and being a mom, you want to be as active as you can with your children and be able to pick your baby up. But my MRI just really showed that I should do something as soon as possible.
Jenna had made an appointment at the clinic, had her MRIs taken at the Bonati Imaging Center, and began her own journey to recovery.
During my MRI review with Dr. Bonati and Dr. Liz, they showed me that my L4-5 disc on the right had completely ruptured and that really any therapy that I was trying before wasn't going to help me any further and that I needed to move forward with surgery. So at that point, during that review, I decided I just need to do this. I'm going to do it next week, and that's exactly what I did. During the review, Dr. Bonati and Dr. Liz both could tell me exactly where my pain was before I even said it. I've witnessed that on many occasions over the years where, patients are amazed that by just looking at the MRI alone, our surgeons know exactly where your pain pathway is. And that's exactly what they did to me too.
She was accompanied into the OR by 2 surgeons, an anesthesiologist, and a team of staff members only concerned about one thing: getting their patient pain-free.
I had a laminectomy discectomy for a ruptured disc at my L4-5 region on the right. My surgery day, I was actually really calm. I'm normally, anybody that knows me well knows that I can be an anxious person, and I walked in very calm. Working here for 10 years, I know a lot of the staff. I felt completely at ease. I knew I was in good hands, and I've never worked directly with the OR. I've known them over the years, but I've not worked in that department, and I was truly impressed with everyone was so professional. I felt so calm. Dr. Campoli was my anesthesiologist. She's amazing. I do remember communicating here and there with both Dr. Liz and Dr. Bonatti during surgery. I remember them asking me where I felt the pain at that current time, and I remember feeling comfortable. I do remember seeing the monitor at times and them explaining to me what was going on, but because I only remember parts of surgery, I don't remember everything that they were explaining to me, but I do know that the monitor was there for me to watch the whole time.
After the exclusive Bonatti spine procedures, all patients are prescribed a regimen of walking therapy. Jenna explains why this process is so important to a patient's successful recovery.
Walking is a huge part of the recovery process. That is what I can stress the most to existing patients or potential patients. You must move after surgery. Even the night of surgery, they advised me to walk up to 40 minutes that evening. If you need to break it up, that of course is fine, but you must move. And your body will tell you that you need to move too. I did notice that after I came back to work, that if I was seated for X amount of time, I needed to get up and do my walking, which I was able to do. But that is I would say, the biggest part of recovery.
Now that she's living a life that's pain-free, Jenna is able to enjoy every day.
A lot of the patients that I speak with on a daily basis tell me that their doctors at home feel that they can't be helped or that they can only be helped by fusion. I've seen over the 10 years of being here so many patients that were told that it was pretty much helpless, their case, or that they needed fusions. They're able to come here and have our surgeries and have success. I've seen patients come here that have had fusions and we're able to help them as well. So I always encourage people, go through our review process, get educated, see if we can help you with your specific case. My favorite part of my workday is seeing patients, honestly, before they leave. I get to speak with some people for months, weeks. I've spoken to people for a couple of years even, before they've made that decision and commitment to come here. So sometimes you get so comfortable with these patients, and I love meeting them initially, but seeing them leave and seeing their happiness, seeing them possibly not have a wheelchair any longer or crutches or a walker is amazing. There's a few patients that just will forever be in my mind because they've done so well.
She also shares how her family has noticed a difference in her overall well-being and how being a patient herself has helped her better relate to patients.
I had my surgery in February of this year, and currently I'm back at the gym full-time. I get up before work while everyone's sleeping so that way I don't miss out on family time. I do my workouts, which consist of lifting weights and cardio. I'm really active. At home, I feel like I'm a better mom. At night when I get home, I'm able to play with my kids, not say that I need to have a break. My baby is very chubby and very heavy, and I find that I'm able to hold him and not have to say to my husband, please take him quickly, I feel like my back's gonna go out. I just feel strong and sturdy. I feel a huge change. And if my husband were here right now, he would tell you I no longer complain. At one point I had said, you know what, you're right. I actually am feeling really great. And I've been feeling great for quite a while.